let everybody know this session is being recorded for the local offer website so that we can put it up for future reference. So because of that, we're just going to ask that people keep their questions until the end. So do feel free to put them in the chat as we go through, and we will answer them at the end, just because that makes it easier in terms of editing the recording. Sorry, Kirsty, did you want to do some introductions?
Yes, thanks, Charlotte. Thanks for reminding everyone of that. Hello, everyone, and welcome to this afternoon's SENCO discussion group. Those of you who have attended before might notice that we have got maybe some different faces to usual today, and I can recognise some of the names of those of you here and some not so much. But for those of you I don't know, my name is Kirsty Wyman. I'm a senior educational psychologist, and I am currently the lead within the educational psychology service for neurodiversity. And Charlotte, I'll let you introduce yourself.
Thank you. So my name is Charlotte Owens. I'm a clinical lead in the Children and Young People's Neurodevelopmental Partnership, and I've quite recently taken over from Mary Trotman as the clinical operation manager as well. I've done quite a few of these, so I have spoken to lots of you before, but it's lovely to be here again.
Great, thanks, Charlotte. So this afternoon's session is going to be focused on reasonable adjustments for neurodivergent children and young people. So in the usual format for these groups, Charlotte and I are going to deliver some input for the first sort of around half of the session, so for about an hour. And then we'll stop recording and we will open up for questions afterwards. So for those of you who have just joined us, you may have missed Charlotte saying, if you do have any questions, please pop those in the chat as we go, and we will address those at the end. We just want to make sure that we don't accidentally break any confidentiality whilst we're recording. So thanks for your patience. I think people are still trickling in, but if we make a start with the content so that we're able to finish on time. So what we're hoping to cover today is, what do we mean by reasonable adjustments? How can we use our policies within school to support the use of reasonable adjustments? What do reasonable adjustments look like in practice for our children and young people that may be neurodivergent? And we're going to look at the use of space plans to record reasonable adjustments. So a sort of practical framework that we can use. Okay, so reasonable adjustments come partially from the Equality Act. So the most recent version we have is from 2010, and that's a key piece of legislation in the UK that looks at different anti-discrimination laws. So it aims to protect individuals from unfair treatment and promote a fair and equal society. And we look at this alongside our code of practice. So the code of practice applies to all children and young people with special educational needs or disabilities, regardless of diagnosis. It looks at identifying needs early and using a graduated response. And it encourages that quality first teaching. The Equality Act protects children and young people with conditions that meet the definition of disability. So we'll look at that a little bit more in a moment, and looks at reasonable adjustments to prevent anyone who is seen as disabled from being disadvantaged. So it's really about how those two meet in practice and what that looks like. So the Equality Act focuses on a number of protected characteristics. So you can see them all listed there. The one that we're mostly going to be thinking about this afternoon is disability. And it looks at all different kinds of discrimination that may be related to those protected characteristics. So the definition is whether someone has one of those characteristics, whether they're perceived to have one of those characteristics, or whether they're associated with someone who may have one of those characteristics. So it really is quite broad. And the Act covered lots of different kinds of discrimination. So that includes direct discrimination, indirect discrimination, harassment, and victimization. So it requires public bodies to look at how their decisions affect people within those protected characteristics and looks to promote equality. And then it also looks at protection in terms of employment.
And I think, like Kirsty says, because it's so broad, when we're thinking about disability, it doesn't have to be a diagnosed condition for the Equalities Act to apply. If we can see that someone has a likelihood of being impacted because of a disability, then we should be making adjustments under the Equalities Act. So I think it's just important to hold that in mind.
Absolutely. Thanks, Charlotte. So part of what the Equality Act covers is education in the UK. So it includes all our children and young people in our education settings to make sure that they are also protected from discrimination based on those characteristics. So we're looking to create these inclusive environments. Okay, and as Charlotte just said, they should be considered for all children and young people, even if they do not have a medical diagnosis. So I always think the term disability is a bit of a funny term to use because I think lots of, but we're talking specifically about neurodivergence today, and lots of people that even have a diagnosis don't consider themselves to be disabled, perhaps, but they do fall under the protected characteristic. So autism and ADHD are both covered under the Equality Act. And that doesn't just mean having a diagnosis, it also means if they're presenting with those kinds of characteristics, if they're awaiting an assessment, if we think that they may fit the criteria for that diagnosis. Okay, so we're going to be thinking today about how schools can support 3 reasonable adjustments. We're going to be thinking about individual needs. So as we've just said, every child is unique. Their needs might not always be linked to a formal diagnosis. So we're going to be thinking about observations from school staff, thinking about the insights that parents have, thinking about the young person themselves, and what insights they provide in terms of what their needs are and how they're impacting. We're going to think about having a proactive approach. So thinking about what these potential barriers might be and how we can support that, even if that diagnosis hasn't been established, or even if we haven't yet got to the point where things are falling apart. We want to prevent anyone getting to that point by putting in support early. We're going to think about types of adjustments that can be made. So that might be changes in how things are taught. It might be the support that's given within school. It might be things that we can do to the environment to make it more inclusive or more accessible. And it might be thinking about what assessments look like. So we might think about access arrangements. And we're going to think about how that can be really collaborative. So thinking about how we can engage with parents and families, thinking about how we can use specialist advice givers, and thinking about how we can include the children and young people that we work with to think about what adjustments might be most effective to support them.
And I think what's also really helpful throughout that process is reflecting on how those reasonable adjustments go gives us so much information when we do come to the stage of assessing those young people who are perhaps on the waiting list for an assessment to consider autism or ADHD. The process of trialing and reflecting on the effectiveness of those reasonable adjustments tells us so much about what's going on for that young person.
Charlotte. It's really helpful to think about when we're thinking about reasonable adjustments, to think about it in the context of the social model of disability. So I'm hoping some of you may be familiar with this already, but the social model of disability looks at the sort of the problem is not within the young person. It's not something within them that needs to be fixed. It's about the emphasis on us within society and within the environment to see what we can amend to remove or reduce those barriers. So we're not asking for the change to come from within a child or young person, we're asking for the change to come from the environment or societal factors around them. So I always think a really useful example is if we think about a wheelchair user through the social model of disability, we wouldn't be saying to them, well, you just need to try really hard to be able to walk. We would acknowledge that they need to use a wheelchair and we would make amendments to the environment around them. So we would maybe be putting in ramps to buildings or using lifts. And making sure that things are accessible to them rather than putting the onus on them to kind of fix whatever is stopping them from being able to walk and requires them to use a wheelchair. Um, and instead thinking, okay, well, what can we do to fix the problem around them rather than seeing them as the problem? And we can apply that exact same logic to any kind of disability under the Equality Act. It's not quite as visible, but the premise still stands. Okay. We're also going to be thinking about using the relational approach as well. You can see there's a quote on your screen from Pookie Knight-Smith. So she says, when we put relationships at the heart of all we do, then everyone benefits, vulnerable children, their peers, and the adults working with them. You might find this really small to see on your screen. But this has come from our colleagues in Devon, and they use these kind of three ideas around the top one, the orange one, is developing relationships. So that talks about developing safety, security, and trust. It talks about supporting inclusion, so facilitating that access to learning, ensuring social inclusion, because it's not just about in the classroom, it's also break times and lunch times, and social times of the day, and developing individual skills. And they talk about setting boundaries, and that being around reaching agreement and building a shared understanding of those expectations so that actually when something is difficult, there are clear processes for resolving those difficulties. Um, the green circle is around responding and calming. So that is about keeping calm. So using everyday interactions to maintain those relationships and promote a calm and supportive learning environment. It's about regulating emotions. So using those relational skills that we all have to regulate strong emotions and calm behavior, and having clear plans to manage crisis if crisis does happen to make sure that everyone stays safe and is supported. And then the last circle is around repairing and restoring. So that's the purple one on the diagram. And that is around using restorative interactions to resolve any conflict that does occur, create a shared understanding about what's happened or what's gone wrong, perhaps. Repairing any harm that has happened. So using restorative encounters to discuss the breaking of agreements, the impact of on others, and repairing those relationships that may have been damaged as a result of that. And supporting change. So thinking about what additional support or action is needed. And I think it's really important to kind of almost use these two approaches side by side and bear that relational approach that lots of our colleagues in schools are using every day for lots of young people. And just a reminder, really, that that still stands when we're talking about reasonable adjustments and that actually this is a key group of young people that really benefit from that relational approach. And we've just got a reminder there around how kind of the steps towards creating a whole school approach around this and what that looks like. So you can see step one is around kind of these leaders within school expressing a commitment to kind of being trauma informed and attachment aware. It's looking at creating an audit of current practice and looking at training needs. It's looking then at thinking about what that training plan looks like, how that includes leaders in school and how that will be disseminated to all staff. And then looking at putting in that graduated approach, supported by whole school policies that considers those restorative approaches. And that's probably where, when Charlotte will talk about the space plans later, some of those will come in and you'll see where those kind of tie in quite neatly. And the same with the last box, so reviewing progress against the actions and reflecting on what that looks like. It's always an ongoing process. We never ever crack things first time round. We always need to kind of review and refine and see how things are going. And that's really important because needs are also not static and they change over time. Okay, so I guess the key question that probably lots of you are asking yourselves or have had discussions about before is what is reasonable? Because I think that sometimes means very different things to different people. So there are some factors here for schools to consider when thinking about whether an adjustment is reasonable or not. So the first one is effectiveness. So it's thinking about, okay, well, how well is this going to work? Is it going to alleviate the disadvantage completely? Is it just going to help a little bit? The second one is around practicality. So actually, how feasible is it to implement this? Is it something really easy, like a pair of ear defenders or noise cancelling headphones that is probably quite easy to implement, or is it something that is going to be a little bit trickier? Cost is always a factor. So financial implications of the adjustment, and this needs to be balanced against the school's resources and funding. We know that funding is a big worry for lots of you as schools. And while cost is a factor, you'll see there's a note at the bottom. It doesn't automatically exempt you from making adjustments. You know, you are expected to use your resources to support all pupils, including those with disabilities. And as we've discussed, that includes young people that don't yet have a diagnosis. And if it's deemed reasonable and necessary, then we should be making efforts to implement it, even if it involves some expense. And again, it has to be balanced and within reason. And the last factor is around the impact on others. So is it going to negatively affect other pupils or staff, or is it not? So it's kind of conversations about all of these factors and weighing them all up together. So some ideas around reasonable adjustments, and we've called these universal reasonable adjustments because I think that they very much apply to our lots of people that within our neurodivergent community, but I think also other groups of young people. So you will have kind of other groups within school that would also benefit from some of these reasonable adjustments. So within the classroom, that can include things like positioning. So some children and young people work really well if they're sat near the front, near to the teacher, so that they can have a little prompt if they lose focus. Some children and young people work much better if they're kind of in a quiet corner of the classroom, away from the noise. We know some young people find it really hard if they're sat with their back to the door. We know some young people like to be sat in front of a wall so that no one can sneak up behind them. So it really is thinking about these individual needs and what that looks like. It might also be about where they work and how they work within the classroom. So it might be using workstations or a quieter area. If they find it really hard to focus. Sometimes that can be a desk that's just theirs. That's in a primary school. That's probably quite easy to implement. In secondary schools, if they're moving around between lessons, that can be a bit trickier. So some young people use kind of portable screens that they use to create a workstation. Lots of different ways that that can be implemented. Okay. Another key one that I mentioned earlier is around exam adjustments. So that might be things like extra time, especially if perhaps processing takes a little bit longer, if sometimes reading takes a little bit longer. The general rule is that kind of anything usually given in class should also be available to a young person in an exam condition. So thinking about what their usual way of working is. Sometimes that also is around kind of using a word processor or a laptop as well, if handwriting is really tricky. Um, Lots of our young people find organisation really tricky. I think especially as they get older and the demands to be organised increase. So it's thinking about the use of timers to help with time management of tasks, making sure that tasks are able to be chunked down into small achievable steps, uh, giving instructions that are written as well as verbal. We know that lots of young people appear to not be listening sometimes, or they find it really hard to process auditory information. So having that kind of prompt to remind them of what they're meant to be doing is really helpful. Having spare resources. There will always be that one young person who hasn't got a pen, and making sure that that's in a place that they're able to access easily. And then another key one, especially for our neurodivergent young people, is around supporting transitions. Again, different school settings may have different levels of transition throughout the school day. So secondary schools tend to have transitions between every single lesson. I guess primary schools too, but perhaps not moving around to the same extent. So having kind of visual maps or buddy systems to help them get to where they need to be during the school day. Um, Sometimes giving advanced warning for any changes. So if you know there's going to be a supply teacher on a certain day, sometimes around fire drills, some neurodivergent young people can find these really, really overwhelming. So giving them a little bit of advance warning for something like that where possible can be really helpful. Or thinking about those points in a day that are going to be really tricky, maybe relating to noise or being super busy. So it might be the dining hall or being in the corridors at break time, and making those allowances, like allowing them to go 5 minutes early, or a little bit later so that they can avoid those crowds and just have a bit of a smoother transition to their next lesson. Other things we might want to think about are things like noise cancelling headphones or alternatives. So lots of young people now use loop earplugs, or they might need to listen to music. Doodling can also help some young people to kind of listen and focus. Um, and they're all sort of things that potentially young people can sometimes get told off for doing in classrooms. So it's just that awareness of whether kind of that is needed and that is an adjustment that they require. Thinking about homework, how that's given and the amount that's given. Lots of young people can find homework to be a real source of stress. And they really need that time at home to kind of decompress from school, especially if they are kind of using all of their resources to manage during the school day. Sometimes even just giving kind of models of what homework should look like. Then they kind of know what is expected. And a key one that we seem to talk about quite a lot is uniform as well. So allowing children and young people to wear alternative uniform that is maybe a bit less distracting or uncomfortable for them. And that doesn't have to necessarily mean that, they come to school in their pajamas because that's the most comfortable thing. It's about kind of finding what that happy medium is. So maybe they wear a t-shirt or polo shirt instead of a stiff button-down shirt that's really uncomfortable, or some young people might wear kind of leggings or black joggers instead of school trousers that they find quite uncomfortable. So thinking about what is kind of practical and again, what is reasonable. Just the last few ones here. So communication. So some children and young people find it really hard to communicate when they're finding things tricky. So having that communication with families to build relationships and kind of share key events, it's really helpful if families can say, we've had a bit of a tricky weekend, so they might struggle a little bit more on Monday morning. And then school staff can be aware of that and kind of put things in place to support before things kind of fall apart and become difficult. Snacks is another one. So lots of people find it really regulating to be able to have snacks at specific times during the day, and they might need a little kind of boost of energy. So that's another one that can be really helpful. And we've just linked there the pre-assessment pathway for neurodiversity intervention. And there's just some kind of more possible interventions and ideas there that you might want to look to. That's obviously just some ideas around reasonable adjustments. It by all means does not cover everything that schools are doing or everything that might be needed. These were kind of key ones that we thought of. Okay, so we've just got a couple of examples here around kind of what reasonable adjustments might look like in action. So we've got a couple of scenarios. So the first one is a child with ADHD or suspected presenting needs. So we don't know if they have a diagnosis yet. Struggles to concentrate in a noisy classroom and often gets overwhelmed by transitions between lessons. So the parent is asking to allow their child to use noise cancelling headphones during independent work and to receive a 5-minute early transition to move between classes before the corridor becomes crowded. So we would consider this to be a reasonable adjustment. And you can see we've included the justifications for why. So it's practical, it's low cost, it reduces sensory overload. It's going to allow them to focus a little bit more. It's not going to affect other students. They're not going to be kind of blaring music, distracting other people from working. It doesn't compromise educational standards or learning objectives. And it's commonly recommended. So, for example, these will be within the code of practice and things that we would expect schools to reasonably be able to do. Okay, our second example is slightly different. So this is a child with autism or suspected presenting needs, has difficulty participating in group work, and sometimes dysregulates when asked to work with their peers. So in this case, the parent is asking for a full-time one-to-one teaching assistant solely for their child, even though they do not have any HCP specifying this support. So we would probably say that this is an unreasonable request. And you can again see the reasoning there. So we're exempting them from all group activities, could deny their opportunity for social development, which is part of their broader educational experience. Full-time one-to-one support without EHCP provision is probably not something that schools are easily able to provide. I know that you haven't all got adults knocking around doing nothing, waiting to provide this kind of support. Schools have got to balance individual needs with the needs of other students. So there may be other students that also need adult support. And the adjustment's got to be proportionate. So there are other things we could do in this case to support. It might be working in smaller groups. It might be having maybe some adult support in group situations, but not all of the time, and providing structure to those peer interactions. So in the first scenario, we would probably agree those adjustments and monitor their effectiveness. And in this case, we would probably aim to work with the family to explore those alternatives, and maybe kind of explaining some of our reasoning to parents. We know there's lots of evidence that explains why full-time adult support is not necessarily the most beneficial thing for any young people. And I think sometimes families find it hard to understand that. So being open and honest and thinking about what the support could look like.
Thank you, Kirsty. I think I'm taking over now, aren't I? But that you've led me perfectly to the next bit, really. One of the reasons that we wanted to come on to talk about how we can record what we're doing is I think often there can be some misunderstandings between homes and schools about what support is in place. And I think having a document where we can clearly detail the reasonable adjustments we've made for a young person in collaboration with the other important people in that young person's life can really help everyone to feel that that there is a plan in place, especially for young people who are waiting for an assessment, we know that we need to get support in place for their needs whilst they wait, because the wait is significant. So when we're looking at our reasonable adjustments and putting them into a support plan, we're doing that because it helps not only to improve things at school for that child and young person in terms of their behaviour and motivation to learn and attendance, but it also has an effect on their emotional well-being, self-esteem and confidence, mental health, and their regulation at home. We see a large number of neurodivergent young people who school takes an awful lot of energy, and by putting some reasonable adjustments into their school day, you might be supporting them to have more energy, more spoons left over when they get home to do the other things that are important in their life as well. Kirsty, I'm going to have to ask you to do next slide each time, I'm afraid. Thank you. So this is just the research paper that the SPACE framework comes from. So this was a bit of research done by some autistic doctors. So Mary Doherty is an autistic psychiatrist. She's done lots of work around the area of how we can support neurodivergent needs in healthcare settings. And that's because for a lot of neurodivergent young people, going into hospital is a time where, you know, they lose a lot of the things that are familiar to them. But we know that it's actually a really helpful and useful acronym, SPACE, that can help us to think of specific but quite straightforward accommodations that can make a really big difference to our neurodivergent pupils. So if we go on to the next slide, you'll see that SPACE stands for sensory predictability, acceptance, communication, and empathy. And I think, you know, Kirsty's already gone through some of our universal reasonable adjustments, and they're really fantastic and highly practical things. I think, as we talked about at the beginning, in terms of thinking about having a whole school behavioural policy that's regulation based, that's where things like the acceptance and the empathy really do come into it. So we'll explore those a little bit more. So why do we use the SPACE framework? Well, we use it because it helps us to have a plan where we can measure what needs to be in place for that young person. We can follow our graduated response to see what's being successful, and we can ensure that everyone around that young person is aware of what should be happening to support them. It's a bit more in-depth often than traditional pupil profiles can be. But it won't be suitable for every young person. Our most complex young people will already have EHCPs or highly individualised support plans in place. So it is a graduated response. And if we come on to the next slide, we have adjusted SPACE a little bit, because initially, when the research was done, it was done mainly for autistic individuals. But as you can see from this diagram here, and I can tell you from our assessment work, there's a large crossover in neurodivergent needs between autism and ADHD. So according to the latest research, we think about 50 to 70% of individuals who are autistic also have co-occurring ADHD. So that's more than half. Interestingly, that number is rising. And also interestingly, until 2013, it was actually not possible to diagnose both conditions at the same time. So our understanding of those has changed significantly in the last 10 to 15 years. And when we've got both autism and ADHD in a young person, we can get some conflict in needs at times. If you think, you know, you've got an autistic need for routine and difficulties with change, and then you've got an ADHD need for impulsivity and being quite spontaneous and full of different ideas, you can see how you can get that kind of push and pull when the two conditions co-occur. So we have adapted the SPACE framework slightly. So you can see on the left-hand side there, you've got the 5 kind of core autistic needs. And what we've done is just to adapt that slightly to make sure we are also including those differences we see with ADHD. So we're thinking about attention and energy levels and safety and executive functioning, which are all areas that we know are often more challenging in a neurodivergent young person with ADHD. And I just wanted to reiterate that this can be used within your graduated response, within your cycles of assess, plan, do, review, to show evidence of what's being tried and what's working before perhaps you consider referring a young person through to an assessment. For lots of your young people, putting in place support might be enough and they might not need a formal assessment, but we certainly don't want to delay support until that assessment has happened. So this does sit within that broader graduated response. The other thing I wanted to mention is this is an approach some of you might have seen us within CYPMP using. With our educational psychology colleagues, we have been able to support some young people on the waiting list by coming out to schools to help with developing this kind of space plan. That's obviously happens in cases where there's very significant concerns from everybody that things are quite stuck with that young person while they're waiting, and then we can send a clinician out to try and help the whole team around that child to pull together a plan that feels manageable with the resources the school's got and feels like it will make a difference to that young person. So that assessment, that information gathering is really where we need to start our bit of work when we're thinking about pulling this together. And that will come from observation in school, obviously from the teacher and kind of the other people working directly with that young person across the school day. Especially important to observe at kind of transitions and break and lunchtime as well, because that's often the areas where we've reduced the structure and there can be some challenges for our neurodivergent young people. Taking into account kind of all your existing recommendations from other services, so speech and language, occupational therapy, educational psychology, CAMS, all of that. This isn't about reinventing the wheel. This is about having a one-page document that helps highlight the most important and most impactful differences we can put in place in an education setting to help that young person feel most comfortable. And obviously parents and carers, having their voice, including them in the assessment process, but also in pulling together this document, is a really good way of schools sharing kind of all the amazing things we know you do to support these young people in school, regardless of kind of how we understand their needs. We do know, and I know that you guys know because we've spoken before at these meetings about masking and camouflaging, that needs are not always visible in school. And it can feel more difficult and more daunting as a school to put something like this together when you're not seeing those challenges in school and the young person is kind of doing okay during the school day. I think, what I would say is where schools have been able to work with families to do this, it can have a huge impact on that young person's well-being in the wider sense, in terms of ability to cope outside of school and in terms of mental health and dysregulation at home. But it does really involve listening to the strengths and needs that parents and the young person are telling you exist, even if they're not things that you're seeing in school. And I think, we have to think about doing what's right for that young person. So sometimes they might very much be masking in the school setting and not wanting to draw attention to themselves. So any support that we're putting in place, we need to do with their kind of buy-in and consent. Otherwise, it's not really going to work. So as we go through the next bit, it might be helpful to just hold a young person in mind, who you know well, who is neurodivergent, so that as we go through the steps of kind of creating a space plan, you can have a person in your mind. As we said, it's a collaborative thing. It can be really helpful once it's produced to just have a quick chat, the class teacher and the young person and the parents, just to talk through it and talk through how we're going to monitor it. If there's somebody else important working with that family, phys worker or CAMS or somebody like that, including them in that. And this is not meant to be a document where we detail everything that we're doing for a young person. This is a one page, these are the things that would make the biggest difference for this young person. These are the areas that keep coming up as causing challenge or causing distress. So, I think that's really important, that we're not trying to put absolutely everything we might do onto this plan. It's going to change over time. Our priorities are going to change over time as professionals, and the young person and family's priorities will change as well. So there's an element of creating a realistic and shared goal, and thinking about what would an improvement look like, what would be a good enough outcome. Because we know for some of our young people who are neurodivergent, being in school is really challenging, and we're never going to get them to a stage where we remove all those challenges and they absolutely love every moment of it. But that doesn't mean we can't do things that make a significant difference and improve that situation for them. So there's a bit of kind of trial and error and being a detective. So this shows you simply kind of what the space plan looks like. As we said, it's an A4 page, and it's not complicated. All areas of support, all levels of support can be included if they're relevant, but it is really about keeping it relevant. So like I said earlier, if you have a young person in mind as we go through, that's great. If not, people might pop up as we're talking through it. So the first one we're going to look at is sensory differences. And I think this is one that schools are often brilliant at noticing and putting strategies in place. It's also the thing that time and time again comes up in assessments from our young people as being the most kind of interrupting to their well-being in the school day. It's often things that feel very much outside of their control. Most sensory input is kind of coming directly at you, with a little bit of those sensations at the bottom there, our sense of proprioception and interoception coming from inside your body. All of the rest of them are often coming directly at you. And if you're someone who experiences senses really acutely, things like the smell of the classroom if it's been painted, or the background noises or the flickering of the fluorescent lights can really make a very, very big difference. So making some sensory reasonable adjustments for these kind of young people might include things like Kirsty's already said, having access to a quiet space, being able to use loops or listen to music in some lessons, having agreed kind of sensory breaks or movement breaks, watering the plants, handing out the books, cleaning the whiteboard. All of those things are helpful. It might be that allowing snacks, allowing mints to chew, allowing them not to be in the dining hall where there's hot school dinners that have a really overwhelming smell. Those are all things that we would consider. We've already talked as well about some of the uniform adjustments. The other thing I think to remember is with sensory, it's very easy to think about the senses that a young person dislikes and finds overwhelming and try and cut all of those out. But for our neurodivergent young people, positive sensory experiences can be hugely helpful for regulation. So movement might be an example of that, but it might not be the only example. So there are lots of ways to build in positive sensory experiences in their day as well, whether that's sensory-based play, whether that's, having favourite things that they can touch or fiddle with. whether it's having time where, you know, they can use the same kind of strategies that they might use at home to kind of snuggle up at lunchtime, somewhere quiet, shut some of that kind of sensory noise out and just regulate a little bit. All of that can be really helpful when we're thinking about their sensory needs. So if we come on to predictability, this is such a key one for our neurodivergent young people. I've been assessing in clinic this morning with a lovely young man who was just telling me how anything that's unknown or uncertain is just so scary. And actually, for this young person, a predictable response is so much better than an unpredictable response. So for him, asking for help feels so unpredictable, whereas reacting in a way that gets him sent out of the classroom to restart feels much more predictable and much safer. So I think, you know, understanding how scary that unknown and uncertainty can be is really, really important. So we know within an education environment that thinking about how long people have to wait for things, how accurate we can be with timings, how we manage transitions and changes is really important to consider. So sorry. Okay, I'll carry on. So again, there's some suggestions up on the screen there. So it might be that you're giving additional structure and routine with visuals or clearer timetables to help. The executive functioning needed at a secondary school to manage a 2-week rolling timetable is really quite a lot for some of our young people. So they might need some additional help with that. People following through on actions and commitments is really important for a lot of our young people. They will heavily rely on it and put all their trust in it happening. And then when it doesn't happen, in terms of that relational approach, that can really take a big hit. And that's going to happen. We're all human. We're all going to get these things wrong. But then thinking about how you can repair with that young person, how you can explain what went wrong can be really helpful. Often that explanation is the key thing. So asking people to do things when they don't know why they've got to do them is a really tricky thing for our neurodivergent young people. They don't often have the same social drive to do things just to please you. So if they don't understand why, then, you know, they can't predict what's going to happen. They don't see the point of it. They're not going to do it. So clarity over what needs to be completed, being consistent in your approach for things, giving extra time to kind of process and ask questions, all of those things can really be useful adjustments that we can make for a young person who struggles with predictability. I think knowing, you know, how we give praise, how we ask questions from them, all of those things can cause a lot of worries for our neurodivergent young people. And knowing that, you know, Kirsty won't be put on the spot to answer questions, things like that can make a really big difference if we can record that on their space plan. So if we come on to acceptance now, I think you know, there's a nice quote there from Hayden et al. From 2021 that says, acceptance means acknowledging the responsibility on carers and professional providers to make adaptations rather than expecting the autistic person to adapt to an environment that wasn't designed for them. And Kirsty's already given you that great example of, you know, telling someone in a wheelchair to just get up and try harder at walking. It is exactly the same. Acceptance of neurodivergence in schools involves shifting our focus from kind of trying to get neurodivergent people to conform to our neurotypical environments, and instead it looks at strategies that help provide environments that everyone can feel comfortable in. And that isn't just about those practical strategies, that is about a whole school understanding and commitment to acceptance around neurodivergence and around diversity and brains being something to be celebrated. It is about schools' positions in dealing with situations of bullying where autism and things like that are used in a negative way to talk about pupils. It's about supporting our young people to feel comfortable enough to be their kind of authentic selves, to take off those masks at times. And if we're able to do that and provide that emotional support and that social inclusion, then we really are helping that young person to reduce the likelihood of them to go on to develop mental health challenges. And a lot of that comes down to that collaborative approach and that relational approach between the teacher and the student. And some of this, I think, is sometimes tricky in school, because when our young people are dysregulated, they do say and do things that can be challenging. But just having a think about how those are going to be managed ahead of time and what adjustments might be made can be really handy. So a young person who regularly forgets their equipment, I worked with a young person and a family recently where the young person's in middle school and actually the parents bought kind of 5 sets of equipment to have one in each of the classes he's in, just so that if he forgets it, the teacher can just give it to him and it's there, and then he leaves it there for next time. It's working really well. The family were happy to buy the stuff. The teachers are happy to remind, and it's taken so much pressure off him constantly getting into that cycle of haven't got the equipment, I get a behavioural point for it. That then escalates into detentions, and that cycle goes round and round. Again, thinking about praise and drawing attention to young people, how we deal with situations where they perceive something is not fair. It doesn't mean that we have to go back on our decisions, but it might mean that some extra support is needed to help that young person understand what happened in a situation where they believe there's been an injustice or something unfair. It might be looking at ways of offering reassurance and help for young people who will find it difficult to ask for that, or ways of supporting regulation. So I think the acceptance bit of the space plan is probably one of the most important and most easy to miss bits of this, really. Okay, if we go on to predictability.
Yeah, before we move on, Charlotte, I think it's
Yes.
also just really important to think about rejection sensitivity in
Yeah.
this bit about acceptance as well. And we could probably do a whole other session, couldn't we,
Oh,
on
we
rejection
could. Yes,
sensitivity?
we could
But
indeed.
actually, it's just that acknowledgement that it might seem really, really small to us, but to a young person, that is like the worst thing they have ever experienced, to the point that it sort of gives them almost like a physical pain. So actually, we might say, right, can you just stop talking and pay attention? And that might seem like the tiniest throwaway comment, but that could derail their whole entire day. So it's just kind of being aware, isn't it, about how you approach things like that. And while they obviously shouldn't be talking while the teacher's talking, how can we address that in a way that stops that from happening and stops that from escalating, but still has the same outcome?
Totally, 100%. Thank you, Kirsty. And I think what's really interesting is, the research shows us that certainly ADHD young people, the number of negative comments like that, stop talking, keep still, quieten down, slow down, they hear so many more by the age they reach 10 compared to a young person who is developing without ADHD. So I think we do need to be really aware of that. And often, because of their executive functioning and social differences, they're often the last one to realise as well. All their friends shut up at the right time, and they're the one who often gets caught out, because socially it just takes a little bit longer to process that really now is the time to zip it and to pay attention. So they can feel that there's an unfairness in the fact that it's always them, the teachers, talking to, because the others are a bit more savvy at being able to manage that. Thank you. So let's come on to communication. And I think with communication, it's the same kind of message, really. Neurodivergent communication is not less than non-neurodivergent communication. We have socially constructed ideas of what is normal in terms of eye gaze and facial expression and gestures. And, it's polite to look and smile and nod to show you're listening. But actually, neurodivergent people tell us how hard that is and how much that impacts their ability to listen and contribute ideas. So we need to think about how we can take some of those communication barriers away. And that might be taking away the need to speak if that's particularly hard under stress. It might be using very clear and straightforward language, not giving hints and using metaphors and vague information. And it might be reminding all staff that actually there are lots of ways of listening, and eye contact, eyes on the teacher, whatever it is, isn't the only way to know if somebody is listening. So there's some more ideas here about reasonable adjustments that we might make around communication. We're seeing a significant number of neurodivergent young people where there is situational mutism, so they're neurodivergent and then you put them in a situation where they're feeling a large amount of anxiety and they just lose the ability to access speech. But that doesn't mean they're not listening, it doesn't mean they're not understanding, and it's our jobs to give them other ways of sharing their thoughts and making choices, and it's really important to include that on the space plan. That's fantastic. Let's go on to executive functioning because I'm just aware of the time. So we changed executive functioning from empathy on the original space plan, not because empathy is not important, it's hugely important, but it comes really under the acceptance umbrella already, and that we know that within school executive functioning challenges using those higher level thinking skills like working memory and planning and prioritization and time management have such a big impact on our neurodivergent young people's success in school. So when we're thinking about executive functioning, reasonable adjustments, it is thinking about how we provide information, how we might chunk it, how we might allow additional processing time, or reduce the number of options that's being given to a young person, or give them some scaffolding and help with breaking a task down and starting a task. I think some of the skills that we are teaching around editing and getting from a plan down to something that actually makes sense for that young person to get all their ideas out and on paper can be really, really challenging. So executive functioning strategies, it's really important to include on the space plan. And like Kirsty said earlier, things that are happening in the classroom absolutely need to be happening in school as well, in exams as well. And exam strategies need to be in place early and practiced really regularly and really consistently across all lessons. So if we go on to the next slide, thank you. So what we hope is that by implementing these space plans, all the members of staff that are supporting a young person have a really clear list of the reasonable adjustments, of the recommendations that can become part of their everyday practice of working from with that young person. And there's going to be a period of getting it wrong, there's going to be a period of the information not getting out to everyone and making sure we've got the right resources to be able to put those things in place. But where we can build consistency, that's really important. And I think especially in secondary schools where there's lots of people interacting with that young person, then it's also particularly helpful. We also need to acknowledge that the plan's not going to be perfect. We're not going to get it right straight away. It's not going to cover every single one of this individual's needs. And I think it's important for us to hold realistic expectations, that things might not immediately change. It's a working document. We should be adapting it as we go along. And if you're feeling really, really stuck with it, give us a ring on the telephone advice line, and we can always look at whether a member of the team can come into school to support you with, further adjusting it and looking at what else can be done to support that young person. So we'd suggest kind of giving it 6 to 8 weeks before you review it, discussing kind of what's gone well and the challenges of it, and communicating that to parents is also really, really helpful. And has the child noticed a difference? Have they found that life has been a little bit easier before than before that was in place? And this next picture is a picture that Ash had from before, but I really like, and that's about thinking about a good enough outcome. So if we're starting all the way over on the right at the red unhappy face, it's pretty unrealistic that within 6 to 8 weeks everything's going to be rosy. It's much more realistic that a good enough outcome might mean moving a point or two along, having a few things that feel a little bit more manageable and building up some momentum. And it's okay to celebrate the small wins. It's really helpful to celebrate, the small wins, and to teach our young people and their families that, this is a process, but we will keep working until we find the things that make this environment feel a bit more comfortable for you. And we're not going to get it right all the time, but we're going to keep talking about what we've got right and what is working. And I think, the more that the young people can see that change can happen and it is possible and it can be positive is really helpful. Sometimes it might not be enough to adequately support a young person's needs. And you can review that through your assess, plan, do, review process. And you can use all of this as good evidence towards further support if that is necessary.
I'd say, Charlotte, as someone that sits on the SEND panel every week, this is the kind of thing that we would absolutely love to see in people's requests for assessment, because it really clearly outlines what you've done so far, what the impact has been, any tweaks that you've made, and makes it really clear that perhaps that young person does need a higher level of support. So it's really, really helpful for us when we're making decisions, because we don't get to come into school and meet every young person. We are really relying on the bits of paper.
Absolutely. And likewise, when we're triaging referral forms, if we have information around these kind of things, what's been tried, what's helped and what hasn't, it really is useful at that time. So I don't know if you want to do the next slide, Kirsty. We're literally at the end now, aren't we? We've got this one more.
It's really just a reminder for everyone of kind of what we have got out there for you to support you with supporting the young people in your settings that are neurodivergent. So our next ADHD training is on the 4th of March, so quite soon. That's with my colleague Ash, so he'll be delivering that. And our next one of these sessions, we haven't kind of put it out and about too much yet because we've only just set it, but it's going to be the 20th of May in the afternoon. So that's when our next one of these is going to be about. And if you have got any ideas around what you'd like that session to be focused on, we haven't got a topic yet, so we're very open to taking suggestions. We've got some feedback that lots of you have filled out previously, and yeah, if you've got ideas, then let us know when we open up the chat in a minute. So really, we just wanted to finish with a kind of a bit of a summary of what we've talked about today. So thinking about the Equality Act, thinking about what your behaviour and your other policies in school look like. Obviously, we want them to be as inclusive as possible to include all young people. Thinking about accessing that training, thinking about using parents to support their often have lots of expert knowledge around their own children, which is really helpful. And then you've got the document there, the pre-assessment pathway for some further support. So I think what we'll probably do now is stop the recording and then open it up to look at any questions anyone had. If you're all right to stop that now, Chris.